10 million more Americans are projected to lose health coverage in the years ahead. They don't disappear from your waiting room. They show up as self-pay patients. The OBBBA reform. That shift is already underway, and it's changing how many practices get paid. Today, we're breaking down what this means for your revenue, both now and in the years ahead. The One Big Beautiful Bill Act, or OBBBA, was signed into law on July 4, 2025. It's considered one of the most significant federal healthcare spending changes in recent years, but it isn't hitting all at once. OBBBA phase-in. Timeline: January 2026. Marketplace and subsidy changes begin. Through 2026, Medicaid eligibility requirements phase in. 2027, additional changes take effect. For practices, this isn't a one-time shock. It's a slow, building wave. So why exactly does this lead to more self-pay patients? 3 key shifts are driving it. Why coverage is slipping: 80 hours per month work requirement with stricter eligibility verification. Renewals now every 6 months, up from once a year. ACA subsidies expired end of 2025, separate from OBBBA. Medicaid enrollees must now prove work or activity monthly, and renewals happen twice as often, both raising the risk of a paperwork gap costing coverage. Separately, expired ACA subsidies have pushed marketplace premiums sharply higher too. Here's the number every practice administrator should know. The Congressional Budget Office projects that OBBBA's Medicaid and marketplace changes will reshape coverage nationwide over the next decade. By 2034, 10 million more Americans uninsured. CBO projection. 71 million plus Americans currently enrolled in Medicaid. As eligibility checks tighten and coverage churns, a meaningful share of them won't disappear from your schedule. They'll become your self-pay patients instead. Industry analysts are already modeling the financial fallout, and the early numbers are sobering. What analysts project: up to 70% of a hospital's net income at risk. Up to 20% of Medicaid patients may shift to self-pay. $68.5 billion in revenue decline, projected for 2026 to 2027. Bad debt and charity care up 18% in March 2026. This isn't just a future projection anymore. It's already showing up in the numbers. It's not just the uninsured driving this shift. High-deductible plans are compounding the problem. The affordability gap. Average employer deductible, over $1,700 a year. KFF. 35 to 40% of households can't cover a $400 emergency. Federal Reserve. That gap between what's billed and what patients can actually pay is where your front desk and collections team now live. Practices can't change the law itself, but they can adapt strategically. Several actions are already becoming common across the industry. 1. Strengthen real-time eligibility verification. 2. Build financial counseling into the patient journey. 3. Use charity and propensity to pay screening. 4. Tighten self-pay collection workflows. A recent Experian Health survey found providers naming eligibility verification and billing as the 2 areas most in need of improvement right now. OBBBA isn't going away, and neither is the shift toward self-pay. How prepared your practice is today in documentation, verification, and collections will decide whether this becomes a crisis or just a new part of doing business. Drop a comment right now. Is your practice already seeing more self-pay patients walk through the door? And if this helped you make sense of OBBBA, subscribe to our channel for more updates like this. Talk to our experts today. 888-444-6041. Subscribe for more such videos.